Low back pain. Low back pain can be experienced at any age, and most of the people experience low back pain at least once in their lifetime. So, why it is important to know about the low back pain basics? Because it is the leading cause of disability worldwide, and it is often associated with loss of work productivity, and thus it is causing huge economic burden. So that is why you should know about the common causes of low back pain. What are the red flag signs that warrants that you should immediately consult your doctor, and how the further episodes can be prevented. Namaskar, myself Dr. Veenu Jain, and I am working as a general physician in Delhi. Welcome to my channel, that is Aman Medicare Center. And if you have not subscribed it yet, then please do like, subscribe, and share our channel, and follow us on social media. So, what is low back pain? And what is the site of low back pain? Low back pain mainly occurs between the lower edge of the rib cage and your buttocks. Most of the cases occur in the age group of 50 to 55 years, and it is more common in women. What are the common causes of low back pain? First, obesity. Second, wrong posture. Third, low physical activity. Fourth, smoking. Fifth, desk job with long sitting working hours. Sixth, psychological conditions like stress, anxiety, and depression. Seventh, unaccustomed work. If a person is not used to doing his like heavy pushing or heavy lifting, and if still does it, then he or she can develop low back pain. And seventh, in postmenopausal women. Eighth, lack of the vitamin such as vitamin D and vitamin B12 deficiency. What are the red flag signs that warrants that you should immediately consult your doctor? First, if pain awakens you from your sleep. Second, if there is any history of cancer, because it can metastasize to your backbone and can cause pain. Third, if there is any history of bladder and bowel incontinence, that is uncontrolled passage of urine and stool. Fourth, if there is any history of trauma or fracture or accident. If there is any history of weakness in the limbs. If there is any history of chronic infection like tuberculosis, and if the person's age is more than 70 years. All these are the red flag signs that you should immediately consult your doctor. Now, how further episodes of the low back pain can be prevented? First, correct your posture. Second, take healthy diet, which should be rich in protein, minerals, and vitamin. Indulge yourself in physical activity like walking, running, gymming, Pilates, and aerobics. Optimize your mental health by doing yoga or meditation. Quit smoking. Maintain your healthy body weight. Get a good sleep. Then indulge yourself into workplace and social activities and make some economic changes in your workplace. Despite of all these measures, if you are having back pain, then please consult your doctor. Thank you.